Good afternoon, everyone. I'm delighted with this invitation and also delighted to be here. So I have to say that the pleasure is all mine. This is a very important health matter that we are discussing here today, that you organized, and the topics are of utmost importance because they are more and more relevant in terms of our health and well-being. And it's very important that we have here those who represent civil society, the patients, but also the health authorities and also other entities. And I think that I would like that first and foremost to express my agreement with what was said before, both by the President of ELOC, but also Mrs. Kuluri in representation of the Ministry of Health, because I see the difference. Since I came to Greece 5 years ago, you already see difference and you see progress. And I think we have to be optimistic. We have to be optimistic in terms of health status overall. We have to be optimistic in terms of on how we prevent and manage cancer. But we also have to be optimistic in terms of how we are dealing with breast cancer. And why do I say that? I say that because, of course, you have a clear trajectory that is showing that mortality is actually going down, and this is very important. This is something you should celebrate, not be happy with what we have, we always should ambition more, but it's clearly progress in the right direction. It's more or less what's happening in most countries internationally. There is improvement in certain areas, earlier diagnosis, treatments are better and more sophisticated, so the therapies, quality of care can also be improved and has been improved in many countries, notably in Greece. So because here in Greece we have this office, which is the only office actually globally focusing on quality of care and more focus on outcomes and patient safety in the context of WHO, it's a pleasure to see that also outcomes and quality is improving, but we have to continue to measure it and to do more to improve that quality because it's not enough yet. Many things can be done, and Greece here is not the best country in the European Union. It's also not the worst, but there are many opportunities, I would say, for improvement. We have, of course, the challenge that we have an increasing incidence, particularly in age groups where we have younger women, and that is also a result of probably better diagnosis and identification at early stages, but all of this compile a little bit the situation that we have in terms of cancer. But what I see here is an audience largely composed by women, which you have to take the lead on this because this is a topic that affects mostly your health, and therefore you should be the ones leading on it and taking decisions around it and not just being the recipient and just men taking the decisions and being the ones with the power. It's not okay. And I say that as a man, that women need to be empowered when it comes to this issue, and it's very, very important. I can see you are empowered, but we can do even more in that area. So the situation in Greece, congratulations, is improving. You have very lively and active organizations like yours and ELOC, which are extraordinary in the European context. You're full of stamina and you are really going there. You are interacting and integrating more and more the discussions in the European context, and this is very, very important. I would like to congratulate Greece for that, because this is a matter not just of the Ministry of Health, health centers, hospitals. Is a matter, like it was very well pointed out both by the two previous speakers, is a matter of also of the society and civil society. So it's very, very important that we do more there. Of course, Greece comes from a situation where it was lagging behind compared to other countries, and in the last years in the EU, of course, we see a lot of progress. And there are areas that normally WHO recommends very strongly. One of them, you need to have a cancer registry. Not just any cancer registry, you need to have a very good cancer registry in all countries. What gets measured gets done. My old regional director, previous one, let's say WHO Director General, Margaret Chan, used to say, what gets measured gets done. And that is important because we need to have clear indications of the situation, the progress, the challenges. We are supposed to know where we are in every country. And I'm very happy to say that in the beginning of March, Greece was still a little bit far. But after a couple of weeks, Greece is one of the best countries in Europe in terms of health systems information, because we launched the Health IQ platform together with the Ministry of Health. And in the Health IQ platform, you have a collection of data from all the sources in Greece. It's a huge leapfrog. It's a great step ahead. And this can only be done with collaboration. We not only collaborated with non-governmental organizations, but with the Ministry of Health and many organizations in Greece, including the health regions, including the health centers, because it's very important that we see how we work on the ground. So I think there's a huge progress here. This all relates with the registry, but beyond that, it's very important that we have really good data, and everyone needs to share their data. We are not at the point where we're hiding the data from our hospital. I'm sorry to say it, that's a very stupid approach. Power today is about sharing, is about being in a community. If you share more your data, you're more powerful, trust me. Your data will be more respected, will be more analyzed. That's the way it should go. We should share more in terms of data. This is why we all should contribute to the cancer registry in Greece, which, like anything else, can always be improved. Another great stride, I would say, is on screening. From the screening program that you have for the first time, let's say in Greece, with the cardiovascular, but also with the cancers. And we in WHO, we strongly recommend cervical cancer screening, breast screening, and colon cancer screening. These three are super evidence-based. Every country should have it. Then there are other possibilities. We talk about lung cancer and others. Depends on the situation and what the country really wants to do. WHO does not impose anything on countries. We just advise. But these three, you should do it. And the one that you are doing better in Greece is actually the breast cancer. So I go to many villages in your country and I see that it has a huge impact. But we all have an obligation to contribute. We as doctors, nurses, we need to promote more and more the screening program. Everyone should be subject to screening. Everyone that's eligible, of course. I mean, that's the age. We're not going to discuss the scientific evidence because you know it better than me, and everybody knows that is evidence-based, and there are slightly differences between countries, but all countries in general are following WHO recommendation. So everyone has to do it. It's very important. And me as a doctor or as a nurse or a health practitioner or as a mayor, I have to promote screening. It's very important. Then all of this should be part of a plan. We need to have a plan, right? It's very important to have a plan. When we don't have a plan, we're actually just navigating by sight. But no, we need to have instruments to guide us for the next 10 years, at least 5, and that's very important to have that plan. So in a way, the ingredients, they're all here in Greece, right? But there is now great opportunity to make even better progress. And that progress will not happen without, I would say, the human resources, the health professionals. The specialists, yes, they are super important. The specialized centers, articulation, collaboration, working together, networks is very important. No cancer centers can work on their own. They have to be integrated. And the countries that have the best results, they always have some ways of working together. That's very important. We cannot dictate how to organize, but it's very important that we have this interaction and we work with each other. And then you have primary health care. Primary health care is essential. Everyone knows the role of specialists, but primary health care is essential for cancer prevention and management, particularly for prevention and including screening. So we really need to highlight that role. And we need to highlight that role not just for breast cancer, but for all cancers in general, but also for other things that affect us, like hypertension. If you take hypertension and diabetes and obesity, you're already talking about more than 50% of all people that consult primary health care centers. So we really need to do more. And the role of family, of GPs, general practitioners, personal doctors, family doctors is very, very, very important. Extremely important. Therefore, here, we need to run in parallel tracks. Specialization, capacity, intelligence, being on the crest of the wave in the best treatments and the best specialists, but also, let's say, the capacity to work in the context of primary care. And then, finally, if you allow me, honorable chairs, just a couple of minutes to say that WHO also has a role, and I have the role to say we can do all of this. We can have the best health system, shiny, beautiful hospitals, the best doctors in the world, nurses for everyone, but if you don't invest in prevention, it's never going to be enough. Never. And when I say prevention, I'm talking about mainly 4 or 5 factors. One of them is the elephant in the room in Greece. Think about your adolescent daughters or granddaughters and try to imagine how many of they vape today, smoke. Did you know that Greece is the country in the EU where vaping has increased the most? In young people, vaping, it's not people that want to quit smoking that are vaping. This is false, completely false. It's sold by the industry as a tool to quit smoking, but it's a tool to capture new consumers, your daughters and your granddaughters especially, more than the boys, because the boys in Greece already smoke a lot also. So there is an improvement in smoking overall, but there's a very dangerous situation. It's called electronic cigarettes and vaping. And this is, of course, promoted by the tobacco industry. You go to bars and discotheques in Athens, today is Friday, right? Go and check. It's forbidden to vape inside. Everyone is vaping. Why? So, but we all agree that this is really a big problem. So you can spend all your money as Greek contributors to your wealth in your country, but you're losing it the other way because we are letting that one industry that kills half of its consumers to get away with it. And this is very important. So we have to do much more on tobacco, especially with a focus on vaping in young girls. Please do that. The other one is, of course, overweight and obesity. It's very important. Overweight and obesity is highly correlated with breast cancer. We know that. We proved it in the WHO guidelines, in recommendations. If you look at our IARC publications, we found that there is really a connection with overweight and breast cancer. Physical inactivity, big problem in Greece again. We have to increase physical activity, half an hour, moderate to intense physical activity every day. So think about yourselves, especially if you're cancer survivors. For cancer survivors, overweight and obesity is a problem. Physical inactivity needs to be addressed. Better diet is very important, probably the most protective factor. More fruit and vegetables, less fat, all those simple things that we know from the Mediterranean diet, we have to do it, especially for cancer survivors. These factors are very, very important. It's not just for prevention. It's to prevent relapse and other cancers and also for example, cardiovascular diseases. So I think I would stop here with a very strong statement that we really need to do more in terms of society to prevent cancer, and that prevention is focused on factors that we know very well, and that all of us, they can't just be done by the Ministry of Health. We all have roles to advocacy, and I would say that around alcohol and tobacco, there's a lot of work also to be done still, and I think that in Greece more can be done. So I wish you a great conference. Thank you very much. It's always a pleasure to be with you. Thank you.